A very good morning to all of you. Today we'll be presenting our CGR on simulation-based teaching and AIMS Jodhpur experience. It's said that to err is human, but in our healthcare industry, any mistake can be very costly in terms of human life. Another industry which faces a similar challenge is the aviation industry, where a human error can cause a lot of loss of human life. So it's very important that we train our personnel so well that the chances of a mistake is minimum so that there is no loss of life. In the realm of medical education, the traditional landscape of rigorous study and hands on experience has seen a seismic shift in the last decade. And the catalyst for this transformation, the COVID-19 pandemic. The global shift towards online learning has revolutionized the teaching methodologies, and at the forefront of this evolution is simulation-based medical education. We have realized that if a situation like the COVID-19 pandemic starts, we have to fall back to an online mode, maybe sometimes where simulation will play a major role, especially for development of psychomotor skills. Simulation-based learning stands as a cornerstone in shaping adept and proficient healthcare professionals. Its essence lies in crafting a dynamic, immersive environment, providing a controlled space for medical students and professionals to hone their skills. Here, they delve into interactive scenarios that engage them on multifaceted levels, fostering a deeper understanding of intricate medical concepts and real life clinical situations. The significance of simulation in medical education transcends mere practice. It amplifies learning outcomes, skill refinement, and ultimately patient safety. By mirroring reality in a safe yet realistic setting, simulations offer a playground for learners to not just practice but to master their craft. This talk delves into the profound impact of simulations in medical education, highlighting their pivotal role in elevating learning experience, shaping skill development, fortifying patient safety protocols, and ultimately enhancing the overall quality of healthcare delivery. As the landscape of medical education continues to evolve, simulations stand as a beacon of innovation, guiding the future of competent healthcare professionals. Now, what simulators can do and what they can't do. Simulators are transformative tools that transcend traditional learning methods. They harness technology to simplify complex learning processes, allowing individuals to acquire new skills in a controlled yet dynamic environment. By engaging with simulators, learners maintain their dignity by honing expertise without fear of real-world repercussion for mistakes. These tools enhance skills by offering immersive experiences that facilitate practical learning and problem solving. Moreover, simulators reduce errors by enabling learners to experiment, fail, and refine their approaches in a risk-free setting. They also standardize assessment by providing consistent metrics to evaluate performance, ensuring a fair and objective measurement of competence across the board. However, the simulators cannot replace a real teacher. teacher will always remain the main our cornerstone of medical education. Similarly, simulators cannot replace a cadaver, a real cadaver, or a real patient, because not all patient will uh, react to a particular treatment which you can predict and create an environment accordingly. Some patient may not stick to those kind of environment. So, though it will help us to hone our skills, we still have to finally rely on a real patient and a real teacher. To take the talk further, I invite Dr. Shilpi Dixit, Professor of Anatomy, to carry on with the deliberation.
Thank you, sir, for the crisp introduction. So now let's start with what is simulation-based learning, and what are the various methods available, and what do we have at AIIMS, Jodhpur. So let's go way back in 1600s and 1800s. This is showing us the history of simulation, in which way back then animal models were the only ones which were available. And who knows better than our campus that no cruelty to animals is the basic theme now. So basically, we have to sort to simulation. So, but way back then, animal models were being used, like sheep liver or lung simulator by Benjamin, or there were various dissections being performed on the dog. I hope I'm not hurting the sentiments of dog lovers. So the another part of it was definitely in the 17th century. There were doll models, or what we say, that's basically kind of simulating, kind of a simulation, but not proper simulation. Is that when we are kind of constructing a doll or a model in which we are able to show anatomy or other things in the to the students. They were dolls as training devices, then they were layered textbooks, sometimes synthetic models. Obviously, they were not exactly a replica of the human body, but they were very close. So the first minimally invasive surgical trainer, which was a virtual reality trainer, came in way back 1995 by Circa. So after that, there were a flood of various simulation or trainers, in which we have in the last century, a lot of innovations have been done. Now, there were multiple reports from WHO and other organizations. As you know, that these people keep on conducting various studies, and they said that there are many kind of errors. To err is human, as sir has said. So there were many errors by the doctors, or by in the situations, in the kind of stress they deal with the patients, that there were various errors which are avoidable if they get trained before they actually deal with the real patients. So Institute of Medicine documented high rates of preventable medical errors, and they demanded that there should be a fundamental change in the way we teach medicine and healthcare delivery system. So one of the recommendations of this report was to restructure the medical education to be consistent with the principles of 21st century health system. So what do we know about simulation? The first simulation which we would think about is definitely the younger generation knows there are various kinds of games, virtual reality. I think the younger lot is actually more into virtual reality as compared to us, and they are much more aware about whatever the virtual reality things available for reading, learning, as well as for gaming. So there are various types of simulations which are actually available. One of them, which you must have heard, and there was a lot in the papers also, about the pilots being trained on the virtual reality. And that means that they actually have never flown a plane, but then they were given a license on the virtual reality. They have been trained, and then they are actually flying a plane. So that is also a little dangerous, but still there was a lot of controversy in that the pilot should also be given training on the real planes. So These were the various examples. Now, what do we mean by simulation actually? It is a very generic term in which we say that it is artificial representation of a real world scenario. So, any educational activity which can be controlled by the teacher is a simulation, or it mimics or basically is just representing a real life scenario. So, why is simulation important in medical education? I think Sir has already emphasized upon it that since medical profession, as I always say wherever we have in the forum, that medical education, medical profession is very much different from any other profession because we are dealing with human life and real life situations, and the stress which the medical people or the medical professionals feel, I don't think any other profession would actually know exactly what is the stress situation. So learning in this case of simulation can be done on convenient times, new technologies for diagnosis. So it is a need of the hour, which we say is competency based education or medical curriculum, in which the students are first given or exposed to virtual reality and simulation based learning, and then they are exposed to the real patient. So some people say that what is skill lab and what is a simulation? What is the difference between the two of them? So let me read it out. That skill lab is where you take everything which you are learning in theory into practice, not on the real patient, but on a depicted scenario. While a simulation lab takes the concept a little bit more further, in which the gap between the skill lab, the theory, as well as the clinical rotation is bridged. That means you can actually create a real life scenario and the student, and you can assess how the student is reacting to it and what decisions they are making. So various kinds of healthcare simulations are available. There are four varieties which we say. This is the computer based, then some kinds it can be procedural. It could be a simulated patient which we use in various subjects like physiology. Then it can be simulated clinical immersion. So various varieties, which I've already told you, can be biological, in which a cadaver is used, or it could be animal, or it could be a simulated patient, or it could be some scenario, or it could be mechanical, which is made up as an artificial situation, or it can be virtual, which is computer based. So, what are the varieties? This again is showing us the same thing: cadaver, animal, standardized patient, live team. Mechanical can be mannequins, white box, or part task trainers, which we have heard about. Virtual is VR, which is virtual reality, and then the gaming, which you know about. So, what will be the levels of complexity in simulation? We already know that there can be from very simple, low fidelity simulations to a very high fidelity, expensive task trainers, etc. Or it could actually depict the entire real life scenario in which the student has to react, has to manage the patient, and the teacher is there on the outside with just assess how the student is performing. So it could be precision placement, for example, like when we train the students for needle placement or for the intracath and everything. We, as our generation or maybe the higher generation, have actually learned putting an intracath on the patient itself. So we were just practicing on the patient. Maybe one side we are not able to do it, then the second side. So this is how we learned putting an intracath or a cannula or a IV line. Or we used to actually wait for our turn as interns or maybe the final year students. Okay, we were just going around the PGs. Please allow us to do it so that we are able to learn. Or maybe central line, or maybe pericentesis or a pleural effusion centesis. So these things we have actually learned on a real patient. And we never used to think how much the patient would actually be embarrassed when we are learning on the patient itself. So there can be ultrasound related, sorry. So there can be ultrasound related manipulation, which is a simple manipulation kind of a simulation. Then there can be complex manipulation, in which I think the surgical sides know better than me, is when you are learning on the scopies or the laparoscopic methods. And then there can be integrated procedures. We have a very high fidelity pediatric simulator, which I will just show you, which is basically the highest level of complexity in simulation. So these are just showing us the examples of various task trainers, intubation, I think we have all done BLS and ATLS courses. ATLS courses mainly for the critical care people. So these are basically done on mannequins and showing us how the intubation is done. I think the COVID-19 pandemic has actually trained everybody to at least intubate a patient and how to manage a ventilator. So this was pericardiocentesis, then the central lines, joint aspiration. So there are various varieties of task trainers which are available. Then definitely there are various varieties of simulators which are available. My personal favorite is this cute little baby, which is actually looking original, but it is actually a mannequin, and it is a lung simulator actually, in which all kinds of lung conditions can be basically simulated on the pediatric, the way the infant or the neonates react. So this is an auscultation simulator. This is the hysteroscopy. This one is the bronchoscopy. This one is an otoscopy, which I didn't know actually. When we were studying about this and I was preparing this presentation, I came to know that there is virtual otoscopy simulator also. So I would just like to show you various varieties of simulations which are available. This is a full adult simulator. So this is an OT simulator. Mimicking the entire situation, managing the patient, the oxygen levels. This is the student who is actually seeing the real life scenario, reading as well as getting themselves trained. And so this one is the wireless instruments. So this is the laparoscopic simulator. If you feel that it is actually a foreign simulator, then we can definitely get it here also. So this one is a situation in which, first see. So this is basically representing a situation which is a very high level of stress situation, in which a patient comes to the emergency and you have to intubate, you have to immediately manage, do a CPCR, you have to secure the vitals. I think only this which is seen by everyone makes everyone wants to become a doctor. I think you people know better what they're doing actually. So there can be surgical simulators, laparoscopy, as well as laparotomy simulators, which I think all the surgical sites would know better. Laparoscopic as well as robotics. The new word in the town is robotics. So everybody needs to be trained in robotics, and then they can actually touch the robot. We are very fortunate enough to have a robo in our AIMS Jodhpur. So these are laparoscopy simulators. There are various varieties of robotic surgery simulators. Then virtual reality. So what is the difference between the previous simulators and the virtual reality? Is basically in virtual reality, it is a computer-based system in which you are learning the situations based on the computer-based kind of computer-based or virtual kind of a platform. So one of the virtual reality which we have is I think everybody has seen it, is the virtual dissection table which we have. Although after using the virtual dissection table, I think everybody would be more interested in using the cadavers for basically a kind of for practice. So let's go on to the experience at AIMS Jodhpur. I think our institute is very young, but still has a lot of experience in simulations as well as the changes which we have made in the medical education from the start. So for undergraduates and postgraduates, we've developed two skill labs, which is the wet and the dry. The wet skill lab is the cadaveric skill lab. We have another new building in which we are conducting various cadaveric workshops for various clinical people. And then there are dry simulation labs, which you know that we have a few mannequins, we have few kind of high fidelity simulation models with different fidelities. Other things are also there. Then for faculty and residents, I think regular workshops are being conducted. Hats off to the anesthesia department. Everybody is being taught how to intubate a patient. So a BLS and an ATLS. ATLS is generally done by people who are actually involved in the critical care. And then we have definitely got a robotic surgery training on simulators. So this is few. These are few pictures showing BLS workshop, then various skill labs, mannequins. So this is one of the ultrasound simulator. So this one is for our virtual dissection table, which is known as Sectra. We will be able to visualize the different locations in our body and we will be able to move and do all the structures with the model. So here we are able to rotate it in all the directions this way with our fingers. We can visualize and do our. Moreover, I can move the structures like the sternum. So one by one, you can go layer wise dissection. You can keep on removing the structures without actually doing it in the cadaver. Application in the spectrum. So over here we are able to see cross-sectional division. So this plane you are over there. This is human anatomy of this application in the spectrum. We can see the different regions of our body, the resistance, the cross sections, and the tools so we can make of the different body parts. So, like for example, we can see over here the breathing. So, if we want to remove the circulatory system or any system, we can categorize for it. So now, by a single click, all the blood vessels are gone, and by a single click, all the vascular supply of brain has been shown. Likewise, the different systems can be seen. Application you will be able to see the movement also. So over here, presently, we will be able to see the lateral section in the leg. Visualizer movements also can be visualized on the spectra. So these are the task trainers which are available at the nursing college for both nursing as well as MBBS students. These are being conducted. First, we are going to see the pendulum from outside. Then we will change the valve speed. So just showing us IUCD insertion. So these are the simple task trainers which are actually available, and the students can be taught how to do it before actually doing it in a patient, which is very painful. The first time we inserted the IUCD, the patient almost cried. This is showing us the position of this IUCD exactly where it should be. So these are the various kind of timings. This is just to show you that actually this is happening. So just to put in that these procedures are actually being taught. So just took photographs of the schedules for the MBBS as well as for the nursing students, various semesters. So this one is the high fidelity pediatric simulator which we have. So this is pediatric SR who's actually explaining. So Dr. Bharat is in charge of the simulation lab. If anybody wants to actually practice. So this was robotic surgery simulation. I was fortunate enough to catch hold of Shashank, so he was able to give me the photograph of his training, which he did for robotic surgery. I think urology, gynecology. I think every surgical department is now actually trying to do robotics, which is like wonderful. Now, there's something new which actually came up. We had a demonstration of the HoloLens, which was done by Microsoft. And this takes simulation to the next level. I mean, I was very surprised seeing all this. Maybe
The HoloLens is absolutely the most amazing piece of technology. Within 5 seconds, I realized that the world had changed. It was immediate realization that this is something exciting and we have to be a part of it. Seeing things in 3D is something that you could do before with some classes. The thing that the HoloLens gives you is the ability to walk around those 3D objects and to really experience them as if they're in the room with you.
It is augmented reality, it is mixed reality. And what that means is I still see you, I still see this room and everything around me, but the digital content is inserted into the room as if it's actually there.
As a teacher, I can see what they're all looking at. And that's something that we think has real power.
It's actually opening up our interactions with each other.
The biggest drive is getting the anatomy curriculum completely done by the time we move into the new health education campus.
Today, we at the Cleveland Clinic are constructing a state-of-the-future health education campus. Our students will learn using the most forward-looking educational programs. HoloLens is a key part of this.
The actual act of dissection hasn't changed in generations. We have to be much more effective and efficient.
The biggest thing about medical school is there's just so much information and so much knowledge we're being asked to learn.
HoloLens is going to enable us to teach in an integrated way, to look at the body in ways they haven't been able to see it. It's sort of having X-ray vision, seeing through the skin.
My mind was just kind of blown when I tried it on. It was perfect. It's really hard to.
I think people find anatomy the worst subject, so it is showing us anatomy, and this one is another one for planning of surgery. So there can be superimposition of the structures on the real patient, and you can actually plan your surgery. And after that, you can see the results. I hope some evidence will also be created for using this kind of a procedure. I think surgical science would definitely help us with the evidence if we get this HoloLens here. This was the most amazing video. So how they are going to superimpose. I think orthopedics is the department. So everything is virtual here. Nothing is there on a screen. You don't need a screen. You can zoom in, zoom out. You can actually teach the students. You can use various steps. You can measure. If you have to put in an implant, you can practice. So if you feel like sleeping, I've come to my last slide. So now the most important thing when we talk about all these things in simulation, etc., is evidence. So we nowadays talk about evidence-based medicine for everything. So we use simulation. We are actually impressed with this simulation, etc. But what is the evidence that actually simulation is going to help us out or make better medical graduates. So there are few studies which have been conducted which say that residents who have participated in the screen-based simulation, they outperformed from their counterparts. But most of the people say that basically simulation is very good for assessing how the students react and how the students behave in a real life situation or under stress. So basically, softer competencies like professionalism can be actually assessed with the aid of simulation technology. So I think we really need evidence that how simulation based learning can actually be helpful for the students and for future generations to come. But one thing in the last I would like to add is nothing like a feel of the real cadaver and a real patient. Thank you. I hope nobody slept.
Hello, everyone. So thank you for bringing this important topic using simulation in healthcare and allowing everybody to use it daily practice to improve patient. Just to add our experience, so we have also attended national conference on healthcare simulation last year, and it was attended by more than 250 participants. More than 800 people also came to teach us simulation, and we also had a faculty program part of this, and out of which one of the almost 40 faculty members how to do simulation. Further than having many things, it is very important also to how to use those many things to teach in the simulation. So teaching is also very important to design those scenarios to predict and to predict also. So just having many things may not sufficient, but learn how to use them in the training.
Yeah, I think he has put in a very valid point. Dr. Bharat has actually got the real life experience of teaching the people. So the new buzzword saying training of the trainers. So I think that is also very important. That first the faculty should know how to use it and how to train the students. And then obviously the students can also try their hand on the mannequins.
So in our department, we are inviting curriculums to daily basis. We are using this simulation in training our fellows after medicine IC, and we also, as an experiment, use this simulation for assessing them in final exam also. Like ICU or emergency, we can't give them the real cases because they can harm us. So we use this scenario for assessing them also how they go to react and assessing the response.
Yes, actually, these simulations basically are very, very helpful in assessment, in which actually the real life scenarios cannot be given. Like neurosurgery, maybe because obviously the the student is in stress and can harm the patient, like in ICU, critical care cases. I think that is a very valid point that simulation can be used for. Then that will be actually truly competency based curriculum.
Thank you, Dr. Shilpi and the Department of Economy for like using this platform to stimulate the PGs and the medical students about the role of the simulation. And I would like to congratulate your department as well as Dr. Bharat. What he has emphasized that we are seeing from the beginning, not only the postgraduates or the medical officers already working with patients here in the real life, he is also training the undergraduates, and the curriculum is to be designed differently for each set of people. For the undergraduates, just a feeling of what is it is like a simulation and the real life is. And for the real doctors who are postgraduate, who are day in, day out, dealing with the patients, how to develop this professional skills and how we can develop the soft skills, that is also very important. And that is what is known as a high fidelity. And you have shown in some of these that high fidelity environment can be created, that scenario we have created, the patient can endure, and how the nursing staff, everybody's quality, and the patient was there for many days. And the light is coming, then there is putting the curtains, and also taking care of the patient went into cardiac arrest,
and then how the team rush to that situation. All these skills are very important, and that is created in a simulated environment. So at any Jodhpur, we are fortunate and we have everything now. So whether you talk about the HoloLens or a robotic simulator, we all have prototype. And there's also like a collage can be created
Malaj.
on the
Yes.
real person to create that scenarios of the injuries or the wounds and how we can handle and how we can recognize those things. In that. So I think at any Jodhpur we have come to that stage, and further that conference has now created a critical mass of people who are well connected now. So this conference, which was starting point on the 3rd September, this is still convened. And we have now the people from the surgical department, they are going to attend, and they are also virtually connected with some of these workshops. And they are also becoming the master witness. Because it is not only these gadgets are required, the person behind those are very important. And I think the Jodhpur is taking a lead also in developing those manpowers who can teach. And I would also like to tell you that IT Delhi became so much interested in our simulation thing that they wanted to become doctor. So they said, I want to learn the anatomy and how it can be used for.
Sir, everyone wants to become a doctor.
Yeah. So now the difference in the anatomy and the surgery is very small. What I tell you, the surgeons are doing the patient's same thing they are handling, but it is a life. Blood is flowing, muscle is contracting, the organs are showing the different colors, and the colors of the hemoglobin and the is changing. Whereas same is happening in anatomy. Only thing is that we don't care for that. Okay, this
If a structure is cut. Yeah.
So I think if these skills can be developed in the first stage about there when they are taking the human cadaver, the same thing like this endoscopes can be used in the anatomy department. So the real life.
Yes, sir. Basically, the cadaveric workshops are an example for it. We generally do conduct workshops in our wet skill lab. And so, yes, definitely, I forgot that point was Molage. That instead of the mannequins, there is a real life person actually who's not a patient but is simulating as a patient and a situation. And the students can be assessed on what they are going to do and how they are going to react. And definitely, one more thing which I would like to emphasize, which Sir has said, is that actually AIMS Jodhpur is very, very fortunate. And you people are also very fortunate to be actually a part of AIMS Jodhpur. Please make use of all the resources available. So, maximum utilization of all the resources is also very important. So, please make use of it. Whatever you want to do, please contact the relevant person and please use